I'm Dr. Streicher. Your question is, at what age does menopause typically occur? I'm going to give you the inside information. The average age for ovaries to stop producing estrogen is somewhere between the age of 52 and 53. But keep in mind, that's the average age. Anytime between the ages of 40 and 58 is actually normal. And while most women go through menopause spontaneously, a lot of women go through menopause as a result of maybe cancer treatment like chemotherapy or radiation. Sometimes it's a medication that pushes someone into menopause. And then, of course, many women end up having their ovaries surgically removed. And those things can happen at any age. But let me start by getting into some specific definitions. Now, let's start with early menopause. I mentioned that it is perfectly normal to go through menopause in the early 40s, but that's actually not common. It only occurs about 3 to 5% of time, and it is considered to be early. The majority of women who experience early menopause, it doesn't happen spontaneously. It's almost always a consequence of surgical removal of ovaries. Now, menopause before the age of 40, generally in the 30s, is also very rare, and that's considered to be not early menopause, but premature menopause, and that's really not in the category of normal. And if you fit into that under 40 crowd, please check out my video for more information on premature menopause. But this is the big question. Why is it? Why is it that some women go through menopause at age 45 and other women are still getting their period in the mid-50s? Well, it turns out that the main thing that influences when a woman goes through menopause, it's genetics. If your mom and your older sister are still using tampons in their 50s, well, chances are you're going to be doing that too. There are also some specific genetic disorders that cause women to go into early menopause. But genetics isn't the only thing. It might be the main factor that determines when someone goes into menopause, but there are a lot of other things that influence timing. Let's start with smoking. I mean, you know where this is going because there's nothing good about smoking. And yeah, it's true. Menopause does tend to occur earlier in smokers. But there's also medical conditions that can push women into an earlier menopause. Autoimmune disease is a big player. Things in that category include things like hypothyroidism, rheumatoid arthritis, or type 1 diabetes. But this is the important part. It doesn't really matter why you go into menopause or specifically when you go into menopause. You need to understand that right now with life expectancy, women are living well into their 80s or sometimes even into their 90s, which means that women spend more than 1/3 of their life after the menopause transition. And I mean, let's be honest here. There is no reason that any woman should spend that many years of her life putting up with hot flashes, vaginal dryness, weight gain, insomnia. It's also really important that when you have that many years without estrogen, you need to protect your bones, you need to protect your brain, your heart, your sex life, and your sanity. So to know how to do that, check out my other videos and articles.